I'm Alex Coulter and I'm the Regional Coordinator of REACH. We worked with Bristol, Devon, Dorset and Somerset. 3 of them are mental health orientated, although interestingly the 4th one, which was the Somerset project, which was ostensibly about healthy living, in fact with young people, in fact quite a lot of the issues that came out were really mental health issues, so there is a lot of crossover between the projects. I think historically arts and health has been quite dominated by either arts and health professionals or arts professionals. So there was an attempt to shift the emphasis slightly towards the health agenda driving the projects. But anyway, we've got a lot of interest from health partners and it showed that there is a lot of interest out there in this kind of work.
I think it's absolutely crucial part of the whole process, establishing the partnerships at the very beginning. And I think it's about finding out from each of the partners what their interest in the potential project is and helping them to shape a project that they can all input into and get something out of. How simple that sounds, partnership working, and how absolutely complex and challenging and difficult it can be in practice.
I volunteered to be a health partner without fully realising exactly what I was letting myself and all the other lovely people who've actually got involved along the way in for.
I love running creative writing groups. I find that they're just magical places where people discover all kinds of things about themselves. The great thing about the REACH project is that it's kind of therapy in disguise. One of the exercises we did was to take some found objects from the beach, like driftwood, shells, seaweed, pebbles, stones, and then we did pieces of writing based on those objects where you had to write from the point of view of the object. In other words, you had to become the natural object and speak with its voice. I'm a shell, well-travelled, coming and going with the tides. I've been on the seabed with my fellow molluscs, and now I've been washed up on the shore. I have a lovely shape, oval and rounded, smoothed by tossing in the sea. And although I've lost the other parts of me, together we resembled a butterfly.
To start actually looking at creativity as being a form of self-expression, which you populate with the content of your lives, really. That's all that creativity is for anybody. You use your experience. And to use that, I suppose, as a tool for finding out who you are, where you are, what you have to offer, gaining more confidence and self-esteem and insight. The work that was produced did actually end up being of a remarkable quality, some of it quite astounding.
And we'll welcome Mrs. Chow to speak. 周婆婆你可以講啦。
我好幸運，即係能夠咧呢個婦女會。
Mrs. Chow said she is very happy to have joined this art club. She never think of, with such an old age, she can draw some brilliant pictures. But now she has very much confidence in herself. So she really wants to say thank you to the artists, Barbara and Karen, and also our group to organize such kind of an art club.
You're aware that they're elderly, vulnerable, don't speak English, etc., etc., etc. And, you know, you meet them on the first day when, you know, you're quite nervous, but they are very nervous and frightened. And within an hour, they're kind of fighting with each other to grab batik pens.
What came out of their brushes and pens almost instantly was just incredibly beautiful and moving.
They're hungry for stuff. They you know, chewed it, didn't they, really? What would be really sad is if it were just to become a kind of thing in a frame that people said, oh, wasn't that marvellous, what a pity we can't do it anymore, because we've moved on and there's some other buzzword that's reached the top of the pile.
Actually, what is important for us as human beings, like our quality of life, you know, that feeling inside makes you feel good, and that is where health must truly come from. It's about being human, being recognised and having your life affirmed through the work you do.
I think the act of being creative at all is a healing thing. It's about, really just making marks with words and images to mirror or express something inside, and that's the most profound thing that creativity is really.
A lot of them have actually said that they feel they don't need to come quite so much now to see the doctor. They've got other things that they now want to do. I think it has helped the people involved to improve their confidence and their self-esteem. Using the poetry and the art, actually get in touch with a lot of emotion which they've not really found it easy to talk about before.
And this has just been a little glimpse into different ways of approaching some of the issues we face. The greatest value is in the feedback that you get from the individual participants. More and more we need to look at diverse ways of delivering the support for people with in their journey to achieve mental health.
What keeps you well and content? Sherry. I like a glass of sherry. I love a glass of sherry. Oh, yes. How do you weather a storm? Well, how do you weather a storm? You just got to put up with it, haven't you? Think yourself lucky with what you got. Instead of moaning, thinking, oh, I want this, I want that, I can't have this, I can't have that. And I mean, you've got it, you can't have it, well, that's it. You must get used to the idea.
What has made this project different to projects that I've done before is that this really was a research project. If we're able to solve the problems that these young people feel inside, then we might then be able to impact on lifestyle choices.
The sort of intelligence that we got from the young people was so contrary to the messages that the NHS were feeding them, literally, in that they just got so turned off by 5-a-day messages and leaflets and flyers and initiatives that being told what to do, whereas actually participating in something, they began to explore an issue on their terms.
Working creatively, I think it's an amazing way to get to deeper feelings, and I think with all people really it's very hard to speak about and often express your feelings, and sometimes there are no words to express how you're feeling, so if you can do that in a creative way through the body or through images or creating still pictures, which is what we worked with a lot, we can really get to the sense of how we're feeling.
Anybody who's involved with work like this realises that it has an incredible value, and the value isn't necessarily measured under health and scientific criteria.
Budget holders are not easy to move. They don't want to have emotional reactions to things, but I think one can make a good business case for healthy communities. Public health is about healthy communities, surely.
And if you didn't have the arts, you wouldn't get a tenth as much of the information out there. People wouldn't feel able to talk about those issues, I don't think.
To build on that relationship through the arts has been absolutely wonderful. The trust that has been achieved is immeasurable.